rural communities, EMS response systems are in critical need of immediate intervention, according to a recent report from the Wisconsin Office of Rural Health. Good evening, I'm John Stofflet.
And I'm Maria Lizignoli. Staffing shortages are at the heart of the issues for departments across the state, including rural areas in southern Wisconsin. NBC
15's Colt Molesky went east to talk with a nearby department about what the shortage looks like for them.
John, Maria, the strain on EMS departments impacts everyone. Either a department is short-staffed, impacting its ability to answer calls, or a department is staffed up and taking on calls in other areas to assist those short-staffed departments, hampering their ability to cover calls in their area.
There's a significant issue with money and people in EMS in Wisconsin.
A study from the Wisconsin Office of Rural Health conducted last fall shows a massive strain on rural EMS departments across the state.
41% of the agencies in Wisconsin have had times when they weren't able to staff their ambulance to handle a first out 911 call for service.
Rural EMS Outreach Program Manager James Small says a lack of funding is part of the problem behind the staffing shortages, saying the shared revenue diverted to EMS is the same as it was back in 1993. Now, to staff an ambulance like this one, it requires at least 2 EMTs, which means if a call is unable to be answered, that means they did not even have 2 EMTs to staff an ambulance.
It takes the resource that we would have had available to our own residents and shifts it to another community.
Deer Grove EMS Chief Eric Lang is fortunate enough to have a fully staffed department, but it means he is responding to calls outside of his area.
So now our residents, if they do have a 911 call, might have to wait for another neighboring department to respond.
Even with a fully staffed department, covering other areas means the trickle impact shifts to yet another department.
We need to invest in workforce development. There's lots of industries that we're seeing worker shortages in. We need to put money into bringing people into those, removing barriers that keep people from coming into them.
James Small says more funding would help bolster department staffs, especially with retention. Better staffing would also bring down response times in rural areas because the department can attend to its own calls. Unfortunately, Smalls says even if these issues are addressed, implementing change could take 5 to 10 years, which means many departments will need to work at a red line pace for the foreseeable future. In studio, Colt Molesky, NBC 15 News.